All right, Dr. Naveen Jonathan, welcome to this interview. Thank you. It's an honor to for us to host you here. Dr. Naveen Jonathan is an associate professor and department chair of the Marriage and Family Therapy program at Chapman University in Orange, California. I also have an honor of knowing Dr. Naveen Jonathan back in the day when I was in the Certificate in Leadership program at AMFT, or the American Association for Marriage and Family Therapy. He was my lovely mentor, and he will stay humble about this, but he's part of the reason I'm here. And so he mentored me through the program. He also serves the AAMFT as the treasurer of the board of directors. So, Dr. Naveen Jonathan, welcome.
Thank you. Thank you very much, Dr. Asimwe. I am happy to be here. Thank you for the invitation. And it's been wonderful to work with you in all of these spaces. And I'm looking forward to our conversation today.
Yes, thank you. So let's dive in. So, do you prefer to go by Jonathan or Dr. Naveen Jonathan? What do you prefer?
My students usually call me Dr. Jonathan or Dr. J. So
Dr.
either
J.
way,
All right.
either one is fine.
All right, let's go with Dr. J. Love
Yeah.
that. My students call me Dr. A.
Okay. Hey.
Um, so, Dr. A, Dr. J, listen to me saying Dr. A. Dr. J,
And
tell
oh,
us a little bit about.
I was going to
Sorry.
say, for the purposes of this conversation too, if you want to just address me as Naveen, that's fine too.
Okay, great, great. Thank you. So, Naveen, tell us a little bit about your identity and feel free to share a little bit about what parts that you're comfortable with sharing with us today.
Absolutely. So I identify as a 45-year-old South Asian, first generation American born. Um, I more specifically identify as Indian American. My parents are from India and migrated here from India. I identify as part of the queer community. I identify as a gay man. I identify as being cisgendered. I grew up and I still identify as being Christian. I'm the first in my family to enter the mental health profession. Also, the first in my family to have achieved a doctoral degree as well. I do come from a long line of educators and individuals that more specifically worked in church settings that provided education, whether that is academic administration, whether that is also teaching. And so that is a little bit of an influence, I think, to where I am in terms of becoming a faculty member. But those are some of the different identities that I have. And I mean, they definitely intersect in many, many different ways.
Yeah. Thank you, Naveen. You definitely wear so many hats. I heard a lot of fast PhD, fast generation. Thank you so much for sharing that part of your identity with us. And as we go along this conversation, some of those questions I might find a way to integrate some of the questions. So you are an MFT, right?
Mhm.
So how did you choose the MFT field over other mental health disciplines and approaches?
Good question. So, when I was in my senior year of college, so while I was in my undergraduate education, I pursued a degree in counseling psychology. In my senior year, I worked in an internship setting where I worked with high school students. It was actually at the high school that I went to that was located in the state of Maryland. I grew up and I lived in the Washington, D.C. area. And so I got the experience of working with the guidance counselor at that particular school. And we would work with students during the day. And it was around a variety of different issues that we dealt with. Um, in the work that we did, I saw the impact when you brought others into treatment. For example, consulting with the parents or actually meeting with the parents, bringing in different school staff and educators that could support the student or could help them to assist them in terms of the goals that they're looking for. So these were really critical. And so for me, I really saw the transformative power of bringing people together, really focusing on relationships. Another area for me me that was really important is looking at individuals' diverse identities and looking at how even those identity groups can also be supportive, but also at the same time where there may be conflicts as well. And so that was another component, that I saw when you look at things through a systemic lens, how important it is to do that. So from there, I explored, I did a little bit more research around marriage and family therapy. And so I decided that I was going to be a marriage and family therapist.
Yeah.
And originally was going to be an MFT that worked in school settings. I knew that I was going to pursue, I had looked at different MFT programs, but I decided I was going to select the MFT program at Loma Linda University, where I completed my master's and my doctorate. And I knew in the state of California, MFTs can work in school settings. So, similar to the experience that I had in my internship in college, I decided that I was going to work in school settings. Now, I have done that, but
Yeah.
my career has taken me in so many other different directions and given me
Yeah.
the opportunity to do a lot of other things as well. So I feel really fortunate to have, explored different aspects of the field. Yeah.
Yeah, I love that. As you speak, I hear a popular concept that we use in our MFT field, multiple perspectives,
Mm,
or multiple ways to get at things, multiple ways to get at where we want to arrive. And so,
yeah.
appreciate you sharing just your passion for bringing people together as
Mhm.
something that really led you into MFT. I think that's really profound and powerful. Um, Naveen, could you speak a little bit about what models influence your practices and why do you practice according to these models or this model? Specifically, if you could, highlight maybe one MFT model or two that stand out for you. Yeah, and why?
Sure. So, in my training, I want to also mention this too. Another reason that MFT really works for me
Yeah.
is when I look at my identities as being a South Asian individual, I think about community as
Mm,
well and coming from a collectivist culture. So,
mm,
those pieces I think also really contributed to my identifying more with MFT. But this leads me into into conversing with you about like theories.
yeah,
Um, for me specifically, the postmodern models really worked.
yeah,
And that is for that, there's a number of reasons. Now, in my training, similar, I'm sure other students as well, I took a variety of MFT theory classes and I was trying to find myself in these theories. Um, and there's theories that really make a lot of sense to me in so
mm,
many different ways in our fields, and I see utility in them. But I was really looking for something that really, really fit and resonated for me.
yeah,
I knew that I wanted to work with the South Asian community. I know that I'm somebody who's really passionate about diversity, equity, and inclusivity and social justice. I wanted there to be models that were more um, working specifically from a collaborative approach, more where the client had agency, more where the client's personhood was honored, more where the client's experience was also given that priority, more where the client was in the driver's seat in terms of their life and circumstances and all the rest. I took a class in my spring quarter in my first year on postmodern therapy models, and we
mm,
covered solution focus, narrative, and collaborative systems. And for me, the postmodern mindset and the postmodern ideology really resonated with me for so many different areas. The pieces around social constructionism and really looking at how we construct meaning with different experiences that we've had, looking at also where the client is the expert, looking also of how the therapist and the client collaborate together. Those pieces really spoke to me, but also exploring the client's strengths. Strengths are something that, even for me and my personal life, my friends, my family will oftentimes say that, I'm somebody who will lift people up, somebody who will look for the good in others, look for the strengths, and so forth. So these are all different areas that really spoke to me. I knew that I also, as I mentioned, wanted to work with diverse populations, my own community, the queer community, also different intersections that clients may have with their identities. And I realized in society, in terms of the experiences people have, in terms of dominant messages that are out there, even the dominant discourses that are out there as well, those oftentimes may not be ones that students I'm sorry where clients may identify with. There may be some conflict that actually may take place where those dominant messages may either have detrimental effects on them, or where the client doesn't feel like they align and so forth. Through using postmodern models, again, I really feel that you're back to, again, having the client be in the driver's seat,
Yeah.
really having them be able to focus on what is working for them, really looking at their own expert knowledge, really assisting them to also recognize that they have the power to make the changes that they would like, and change the course of their life. So all of these areas are really where I operate. I do gravitate more towards a solution focused mindset. I find myself being very curious about different aspects of clients' lives. For me, I'm always looking at exceptions for
Yeah.
clients in terms of their journey. I'm always looking at how do you change a problem mindset to more of a solution mindset, or how
Mm.
do you change that to solution talk. I very much believe that problems that clients may bring, they have exceptions to them. That doesn't necessarily mean that the problem does not exist. It just may not exist, or it may look different in different circumstances. Or
Yeah.
maybe the problem did not exist to the complete degree that it did, in this particular instance. So those kind of things really are why I gravitate towards this. I do believe that individuals have the solutions, the power, the strength within them to make it changes in their life. And so I love including hope. I love being able to speak about that to my clients, offering that to them. I like also being able to point out client strengths and really sit with that with them, and
Mm.
also test out different possibilities. For example, um, using scaling questions,
Yeah.
around, for example, possibilities, maybe looking at a client's level of motivation or their thoughts or feelings on making a particular change, being able to assess where they are from week to week. I've also worked with clients where the problem seems very insurmountable. And from those particular places, I always start out with exceptions first. But again, if there's this problem that seems very insurmountable for them, I will then oftentimes use a miracle question at that point, to assist the client to think about and to give them permission about what life may look like beyond the problem, or if the problem didn't exist.
Yeah.
Um, I also like using clients' language, really asking them more about it,
Yeah.
helping them to understand the words that they use. What meaning do those words have? Deconstruct those meanings as well.
Mm.
So these are all different
I
things
love
that I would say that I use from that solution focused mindset.
I love that you perfectly summarize the postmodern approaches, you know, um, excuse me, and reminded me of my graduate school days, when I started off very postmodern, and I am still very postmodern in very many ways, of course, with a little bit of integration, as
Mm,
I like to say. You hinted on solution focus as being sort of like your dominant
mm.
postmodern model through which you approach your clients' work. Um, First of all, let me back up a little bit. What kind of clients do you work with right now? Do you have a specific group that you work with?
So I work with a variety of different clients. For me personally, I love working with couples and families, but I tend to get a lot of individuals. So
Yeah.
right now I'm working with individual clients. I
Mhm.
work really actively in several different communities. my own community, the South Asian community, dealing with a variety of issues. These include intergenerational, relational issues that may emerge, dealing with issues such as immigration, acculturation stress,
Mm.
marginalization and discrimination. Also, some interfaith, intercultural, like coupling,
Yeah.
parenting, things like that,
Yeah.
as well that emerge. I also work within queer spaces as well.
Mm.
And again, for a variety of different issues that may
Yeah.
emerge. Some of it around, again, marginalization, oppression,
Yeah.
that the clients may face. I've also worked with college students. I enjoy working with them, especially as they're thinking about launching and looking at, stressors in their life, even with other providers, and like looking at their own uh, in their own journey, either in their profession, things like that. So yeah, I work with a variety. I would say definitely queer spaces and clients dealing with immigration and acculturation stress,
Yeah.
um, and and especially from my community, those are oftentimes the clients that I work with.
Thank you, Naveen. Wow. I like the diverse pool of your, not only your clients, but the types of problems that you work with and issues that you try to help your clients navigate and find solutions to. That's really amazing, and thank you for highlighting that. So I want to transition us a little bit to think about, like, you talked about solution focus and you talked about two main interventions that are like fundamental to the solution focus approach. And those are exceptions to the problem and also scaling questions. Could you think of an example, maybe that's from your client or the clients that you've worked with in the past, where you have recently used this intervention, one of this intervention or both of them, and how it worked out for that client, or if it was a family, if it was a couple, or if it was a college student or a queer client. Um, how did it work out? Could you please give us a little bit of that description if you have a specific example that you can think of?
Sure, I'm going to use an example, but because of client confidentiality and because of
Yes.
the fact that I do work with some clients from marginalized communities, I want to be really careful. So my
Yes, please.
example may be very vague. So I
Keep it
just
as
want to
vague.
preface that,
Yes.
in our conversation here today.
Yes, please. Thank you.
I've done some work with a client who has intersecting identities. And they have dealt with a variety of different challenges. There's been grief and loss that has
Mm,
taken place. There have been times where there has been their own experience. They've experienced some um, discrimination, oppression because of their identities. There's also even been some of their own internal questions of how do I sit within these identities, memberships within these identities? How do I even be relational in these communities, including, building a support system, a peer system, even, exploring coupling, dating, etc. Um, Oftentimes for this particular individual, one of the things that they noted is that anxiety would build, when they thought about all of the different aspects. They were also found themselves to be very driven. They were very career oriented. They would talk about the fact that, that was just something that they enjoyed, but they had a lot of different things. So they had the work, they had the identity, experiences with the identity groups that they had, the marginalization, the oppression as a result of being a member, then also again finding their place and what does this mean for my identity, and then the grief and loss issues that they had also experienced. And it was really interesting in terms of looking at the anxiety, because the client came in talking about the anxiety that they were dealing with. Using exception questions, it was really helpful to identify when the time that anxiety was not at play, when
Mm,
the times anxiety looked a little bit different,
mm,
or maybe even the level of anxiety that they had differed. So that's not to say that the anxiety did not completely exist, but
Yeah.
rather it was experienced at a lesser level as compared to other instances.
Mm.
By dialoguing with the client a little bit about that, inquiring, being curious, that was very pivotal in terms of the client realizing, okay, so anxiety does not take complete control. It looks different in these spaces. For us, then at that point, really spending time to explore what was going on then, what was happening, because those are key places where then we can look at maybe perhaps the specifics around that and be able to explore how we can apply that into the client's life. And
Yeah.
so that was really a good place in terms of shifting that focus and moving
Yeah.
from problem talk to solution talk.
Yeah.
Sometimes for this particular client, you had mentioned about scaling questions. I want to talk a little bit about that. Sometimes
Hmm.
for this specific client, they would note those exceptions, and then they would form some ideas about things that they would like to explore, maybe paths, directions that they would want to take to address some of the issues that brought them into therapy, to even cope and to deal with the anxiety that they were dealing with. And the client sometimes would be hesitant. So, for example, we'd get to a place where the client would come up with all of these ideas, but then you would see when we dialogue, it was present sometimes through nonverbals. And even sometimes the client even just, through the way that they were speaking or hesitating about
Yeah.
this. So, using a scaling question was really helpful to be able to say, on a scale of 1 to 10, where do you see yourself as being um, likely to try out this
Mm.
particular idea that you have? Using that particular number was really helpful because then we could dialogue further to say, tell me about what does it mean? For example,
Yeah.
on a scale of 1 to 5, if you are at a 5, or rather, on a scale of 1 to 10, if you are at a 5, what does a
Mm.
5 look like? What does that
Mm.
mean?
Mm.
Why not a 4? Or maybe
Mm.
why not a 6? Or how could we
Yeah.
get you to a 6?
Yeah.
Similarly, in talking about anxiety that this particular client was dealing with, it was very helpful with scaling to get to the point where the client could assess on a level scale of 1 to 10 where their
Mm.
level of anxiety was that they had experienced. And it also assisted the client to be able to track their levels of anxiety through the day and through the week
Mm.
as well. It
Mm.
got to the point where the client would come in and say, "I can actually tell you, Naveen, like where I am,
Yeah.
and without me
Wow.
prompting." So, that was
Wow.
also really helpful to
Yeah.
them as well. Yeah.
Yeah, and it goes back to what you're talking about, feeling like like in postmodern, the idea that client is in the driving seat. Like,
Mhm.
I can imagine how powerful that feels for you, the therapist, to hear your client come back and say, "I can tell you how I feel. I can look at that scale and tell you on a scale of 1 to 10,
Yeah.
I am on a 6 or on a 7," and then
Yes.
from there you have a conversation about meaning. What does a 7 mean? What does a 8 mean? Why not a 4? Last week you
Right.
had a 4. I love that. That's pretty profound. That was very clear. Wow. Um, oh man, I could talk to you about this the whole day. Finally, before we close this conversation, could you describe some contextual challenges that you've come across as a therapist using the solution-focused approach? Is
Absolutely.
there
So
any?
I want to talk about this in a couple of different ways.
Yes.
And I want to just share this. You are getting solution focus through the Naveen Jonathan way of
Yes.
looking at the world. You
Yes.
may have conversations with others in the field who are using this model who think and apply the model very differently. And
Right.
there is validity in that. There is a lot, this is again, also thinking from a postmodern mindset, and in terms of this, there's a lot of ways that we're able to do and see the world and think about it and carry forward that carry just as much meaning. So I just want to say that because I think that that's important. But here's my experiences. Um, for me, I think sometimes the solution focused model is misunderstood.
Mm,
Yes, the model is very future focused, from it's present and future focused. There's a part of that where I think individuals then say, well, isn't the past, important to explore? Do you not? Do you just reject, the past when clients attempt
mm,
to bring it up? The piece here that I think that gets misunderstood is that there is value in exploring how things have been done. For example, in looking at exceptions, you look at past scenarios and experiences that the client has had. So,
yeah,
I mean, you are in a way doing that. The really key piece is that it's really moving a client from being very caught up in the problem, which again, can very much happen. I mean, even as a solution focused practitioner myself, there's been times where I've been dealing with various issues in my life, and and I don't see like, I don't like see like the end
okay,
result. Like I think like this is just the worst. But
yeah,
the part here that I think is really important is being able to use the elements from the past and be able to explore what can you do now, what do you want to do now, and what do you want to do in the future
yeah,
as
yeah,
well. That I think is really important. Another piece that I want to say that I think is really important. Sometimes and this can happen. You're working with a client, you're delivering an intervention, you're working with them, and it just feels like the client is just not,
yeah,
they're just not grasping onto it or whatever.
yeah,
And it's so easy at that point. I can admit that there's times where I have felt like that. And then as being a clinical supervisor, sometimes I've seen also other therapists that'll be like, okay, well, what do I take from what, air training that I've had, another intervention, or maybe I need to just completely abandon the model. One of the things that I learned from a very dear mentor of mine was about staying true to your model, and that your model will
mm,
always help you to find the
mm,
end result.
wow,
I think that that is really key. Sometimes I've worked, especially with this model, where I know that I've been trying to work and I'm like, why does it feel like the client is just not connecting?
mm,
Or why does it feel like I'm working harder than the client?
mm,
And I'm realizing that maybe perhaps, again, thinking about the client being in the driver's seat, it's
mm,
important for me to look at the client's place in life, their motivation, their ability to change. Maybe perhaps like I've worked with some people where, for example, some clients, they do have these goals and desires to change, but right now there are some other pressing issues and needs in their life that they need to attend to.
yeah,
For example, I used to work in a nonprofit agency for clients to focus on, finding, sustainable employment, looking at housing, looking at food, looking at at shelter, clothing, taking care of their kids, because of taking care of their kids, a reduction, a lack of like maybe perhaps support, for childcare, things like that. I get it, and coming into therapy and saying I want to do XYZ goal may seem at this point not the
yeah,
time for them to do that. Or
yeah,
maybe you are in the mindset of saying that I'm not the one that needs to change, my partner
yeah,
needs
right,
to, or my family needs to.
yeah,
Or it's kind of like, you have other clients who may come in and you may feel like, they're just not that, they seem to be hesitating. Maybe perhaps, this again, back to, is this the right time for change? I truly believe that a client knows what's best for them. Having
mm,
conversations, being able to talk about these particular things with them. What am I observing? Checking in with them, I think is really important. I'm going to say one more thing,
yeah,
and that is I've also hear a lot about how, well, but in solution focus work,
mhm,
It's so client driven. Where is the part of the therapist? The therapist is a collaborator. It is your
Mm,
responsibility to also walk with the client, to journey with them, to see what emerges, to ask about things you're curious about. Sometimes I also hear, well, we're unable through postmodern models to confront a client. And I'm always curious about that language of
yeah,
confront. For
yeah,
me, I see that there are abilities to do some of that work, maybe perhaps in the way that you think about confrontation. But like for me, when I hear discrepancies in client stories, I
mm,
will oftentimes say, I know that you mentioned this,
mm,
at this particular time, or you've said this. I notice now you're also saying and doing this. So help me out here because there's this and there's this. And,
wow,
like being able to talk and to dialogue about it and to see maybe there's been a mind shift, maybe perhaps again, there's other things that are at play for the client that we need to think
mm,
about and to consider. So
mm,
again, those are some of the things that I think about, some of the challenges that I hear more as a
yeah,
supervisor, as an educator, in this work. So yeah, I
wow.
wanted to share that.
Thank you so much. You've hit on all of the ones I've heard too
Mhm,
about mostly postmodern approaches.
mhm,
But I also like how you give your perspective as to how you can overcome some of those challenges to still say this model is actually helpful. Staying true to your model is something that I took away also from just having this conversation with you. Because yeah, as an educator, sometimes you're training therapists and they get somewhere and they're stuck and they're like maybe the model is not working. They're tempted to abandon it and pick another one. That's how I was tempted, in graduate school until
mhm,
I had to find an integrative approach that works for me,
mhm.
which is a point you hit on a little bit earlier. The idea of finding yourself in the model. I really resonate with that so much. So, final question, Naveen. Do you have, maybe not a question, but any words of wisdom, advice for folks that are out there and they are questioning if MFT is their field, if they want to go MFT, or they're already in MFT and they are wrestling with the models? You learn how many 10 plus, 14 plus models of family therapy. People that are interested in the solution focused approach, any words of wisdom? So it's kind of like a one question but has two
Okay,
sections.
I'm going to try to answer both, but again, if I somehow miss one of those questions or I need to clarify, please help me with this.
Yes.
So
Yes.
I want to say for the first part about MFT, if
Yeah.
you are someone who I'll say like this, I know for me that I'm biased. I see us as human beings that we are in relationship constantly, whether again within our family system, our peers, our school, work, larger systems that are at play, all of that. And so for me, if you are somebody who thinks that way in terms of relationally, you think about systems, you think about identities, you think about membership, you think about all those impacts that could both support but also perhaps provide some conflicts for the clients, and you're looking at exploring how to assist them in that whole relational systemic approach, this is the career for you. In terms of if you are a student searching for a model, I encourage you to really look at several things. First of all, all of the models in MFT have different philosophies. For example, how does change occur? What is the role of therapy, of the therapist rather? How do you wrestle with issues such as functional or dysfunctional families or relationships? How do you view pathology that is there? Even looking at larger issues, do you see clients as having some type of a deficit, or do you see them as being more strengths based? It's important that you really look inward, but also look for a model that resonates for you. Because again, I cannot emphasize enough that, especially when choosing a model, it's important for you to have connection. It needs to speak to you. You need to find value. You need to be able to find utility, and you need to be able to work from that perspective and be able to facilitate the therapy session. For solution focused work, If you are interested in that, I would encourage you to gain consultation, to look at opportunities and where you can read further. There's a lot of good literature that is there in this particular model. It's important to note that this model is not a manualized model, in meaning that there are not, you ask this question followed by this question followed by that question. It's really because, again, as human beings, we are so dynamic. We come with lots of different thoughts, ideas that carry meaning and influence, and it's important, again, to really spend that time with your client. So, in the same way, to do your own work, really looking at what words, what meanings do you have to the various places in your life that you carry meaning? Maybe places also that maybe there's ambivalence, there's also pain. Really being able to explore those things for yourself. Also being very curious. Like, I know my students, my supervisees, even my friends are like, "Why do you always say that you're curious about everything?" And I'm like, because I am. I really am. And so,
Yeah, yeah, you are.
like,
You are.
really defining, really exploring that level of curiosity too, I think is important. So I hope that I
I love.
covered a lot of the
You
points you
covered
asked.
more than I
Okay.
expected, so thank you so much.
Yeah.
Yeah, we could go on and on about the curiosity part because I love your curiosity, and you definitely taught me a lot about curiosity. When you think you know about something and then you learn it from someone else, like your mentor, then you're like, oh my gosh, it's another level. Dr. Naveen Jonathan, Chapman University, thank you very much.
Thank you, Dr. Asimwe. This was wonderful to have a conversation with you. I hope this is helpful to students and to those that hear this conversation. And, if you ever want to have further conversations with me, I say this to you as well as others that listen. My last name, Jonathan, at my university at chapman.edu is my email address. Always happy to talk to people. And if you happen to be at a conference or training or whatever, and please come up to me and talk with me. I'm always happy to do that.
Thank you so much.
All right. Thank you.
Thank you, my friend. Wait, I'm trying to stop recording.